Well, Bill, thank you for joining us today. I really appreciate you taking the time, especially now that you're really busy working on this new IOM report. So, you've been a legend in public health. You were involved in the eradication of smallpox. You were CDC director of the Carter Center, have worked with the Gates Foundation. What do you think are the most important lessons from the past that we should think about when we think about the current COVID pandemic?
Well, thanks, Carlos. There are a lot of lessons, and it makes me wonder why we even have to review them now because they're so clear. One lesson is that over the last 30 or 40 years, we've had a new emerging infection about once a year. And 75% of the time, it's involved in animal. Why we don't have animal surveillance and human surveillance in the same place at CDC and WHO, I really don't understand. But there are other lessons, and I think the first one is know the truth. If you don't know the truth, then you're just blindly reacting to something. And to know the truth, you have to have a surveillance system that gives you the numerators and the denominators, and then lots of information in order to interpret those numerators and denominators. Tom Frieden put out a piece last week, I think 18 of the items he would like to see states reporting on, and no state reports on all of them. Most of them don't even report on half of them. So there's a lot to do yet in surveillance. But a second lesson is you need a coalition. None of us will do anything on our own. You need a coalition, and the best coalitions come to agreement on what's the end point. What is it you hope to accomplish? When will you know that you've actually reached the goal? A third lesson is avoid certainty. And Richard Feynman, the physicist at a University of Washington lecture in 1963, said certainty is the Achilles heel of science. And if we're so certain on something, even if it's what we could use for treating coronavirus, so certain that we don't listen to other things, that's the Achilles heel. And he said, even in physics, which is one of the most certain of sciences, we keep finding new things. And he said he was shaving one morning, and all of a sudden it came to him that the certainty of physicists on why left and right are reversed in the mirror couldn't possibly be true, or top and bottom would also be reversed. And it started him on a whole new venture of trying to figure out what happens when you're looking in a mirror. Another lesson is continuous improvement. You have to have such good feedback systems that you're improving all the time on what you're trying to do. With smallpox in India, we had a meeting every month with the field staff to figure out what seemed to work this last month, what didn't, what should we do next month. Another lesson is respect the culture, because if you tangle with culture, culture always wins. And with COVID-19, we know there are groups of people who suffer more from this virus, and we have to respect that and figure out how to give them special attention. And I think one of the great lessons is that the best plans come from the best science, but the best results come from the best management. And on all of these, I don't have to tell you how they apply to COVID. You can tell right away looking at them how they apply. Then we've learned that the best solutions are global solutions, not national solutions. We absolutely need WHO. It's important to us. It's not just that it's important to them. Then there's the lesson of the importance of political will. Without political will or confused political will, you neutralize the science. And that's what we see over and over, confused political will. And finally, one of the lessons is tenacity. Just never give up, just keep trying. So those are some of the key lessons, and we can go down the list. And when we ask, what do we need to do today? Look at that list and see how do we improve on each one of these, because we can. And we need to do all the things we keep hearing all the time on television. But I think one of the most important right now is to align political will so that it's supporting the science, and so that it doesn't just disrupt the science because everybody has a different idea on what to do. But we also need much faster turnaround on testing. My granddaughter had some symptoms last week. She called me and asked me what should she do. She called Kaiser. They said, come in immediately. They tested her in the car, and 24 hours later, she had the results of her test, which were negative. But it shows you it can be done. And if you had a military logistics expert looking at this, they would very quickly tell us where are the bottle points in this that we have to correct. So there's a lot that we could be doing right now. And I think the testing is one of them. But finally, we do testing because of contact tracing. And I hear all of the reasons why it's difficult to do contact tracing. 44 years ago in India, we were doing contact tracing. And in one state, we were having 1,500 new cases a day. That meant 1,500 new investigations a day, finding the people, quarantining them, putting watch guards on their houses so that we could vaccinate everyone that came to visit them. And we were doing it, 1,500 new investigations a day without smartphones and without computers. And so it can be done, but you have to say this is a priority. And it can't be a priority if it takes 6 days, 8 days to get the results of tests.
Yeah, it kind of defeats the purpose of contact tracing if you don't have the results on time with a virus like this one. The you thought a lot about this, and obviously you know where you have a lot of lessons from the past. What are your fears going forward? Where do you fear the most about the way we are going and the way the response has been and where we will be?
Well, my first fear is, of course, this is going to go on for a period of time where it shouldn't go on. And these are actually people that are involved with sickness and death. And we look at numbers, but we have to look at faces. Behind every one of those 140,000, we have to see a face if we're really going to respond correctly. A fear I had for a long time was if we have a vaccine that's only 50% effective, then it means with everyone vaccinated, we have to follow up to know which 50% are they in. And they don't know if they're protected or not. It's a lot of work. Now my fear is that we might actually have a confusion of too many vaccines. And what do you do if you start with one vaccine and 3 weeks later, a vaccine that looks better? Do you discard the first vaccine? Do you give it to people lower on the totem pole? Do you give it to another country? No, no one's going to accept that. And so we might have problems with so many vaccines that are good. I still worry about what if we have a Qatar incident? And most of the people in your audience weren't born at the time of the Qatar incident. I was in college and I remember it. And 2 weeks after that press conference at the University of Michigan saying, we now have a vaccine against polio, and everyone is excited. 2 weeks later, we started finding children with polio who had been vaccinated with Qatar vaccine. And then we found that there was still live virus in that vaccine. So I worry about that. I worry about the ill effects that you can't see in 30,000 people in a field trial. You have to get to 100,000 to 1 million before you see what are the adverse effects. I worry about people accepting the vaccine. A third of Americans say that will not get vaccinated even if there is a vaccine. And if you're a minority, how can you feel confident that for the first time society is now giving you a preference and you say to yourself, no, they're using me as a guinea pig because they don't want to be the first ones to be vaccinated. So I have all kinds of worries, but in the end, I'm optimistic. I think a year from now, we're going to be writing papers and reading papers on why this worked. And so with all of the problems and all of the things we still have to do, I'm optimistic that the vaccine is going to give us a way out.
Well, I like optimism, Bill, because I think that's always been a characteristic of yours, and that's always been something that I see you bring to public health every time. Even when the worst of circumstances, you figure out a way to find the way out. So thank you very much for your time. I really appreciate it, and I'm sure people have enjoyed hearing about you. Goodbye.
Thanks for asking me. Goodbye.